But let's think about layers. So we have sensitive data, pseudo-anonymized, dynamic synthetization, and then you have synthetic data maybe. So then you can, different layers of privacy and protection.
La última pregunta.
The last questions, because we gone over our time, please. Yes, please. Ask your question.
Thank you so much. From Johnson & Johnson. I head up bioethics for the company. A bit of a comment, would love to get reaction because, and I'm sorry, Leia's not on the call. I wanted to react to her benefit sharing comment and the reference to the Nagoya Protocol. And I think we have to be careful to avoid including something that would make it less desirable to include data from particular regions if we have sort of these things that might not be able to be operationalized. How do you return those benefits from the individuals, especially, Edson, with what you were just talking about with anonymization? And would be interested if anyone wants to reflect, particularly Fernanda, of like what good might look like in terms of benefit sharing, and then maybe throw a plug in for the next open expert meeting to bring in some of the entities or representatives from the entities that are expected to do the benefit sharing, to see maybe if we can brainstorm some ideas about what good might look like. But if there are some reflections, but Edson, you just really commented on a lot of the difficulties it would bring to actually return benefit to places and original sources. So I don't know if anybody has any ideas or thoughts that they've come up with. So it was a little bit more of a comment, I apologize, but I just wanted to plant that seed.
Perfecto.
Eu acredito que os organizadores vão considerar isso na próxima reunião, e é muito importante que todos os interessados, all interested parties, listen what is interesting.
To guarantee equity with governance in the same speed of technology. I don't have an answer for.
Eu não tenho uma resposta para isso. I don't have a question, an answer for that. I'm sorry. I am sorry, I'm not listening to the microphone.
Bueno, vamos a ir.
Let's have a coffee break. We have a few minutes to rest. I thank the panelists and the quality of the discussion that we had. Thank you all. Thank you for being here.
It's been a fantastic morning so far, and looking forward to our session here on governance, oversight, and global use. And thrilled to be co-moderating here with my colleague, Professor Antonio Gonçalves, yes. Okay, who's a surgeon here in Sao Paulo and the president of the Paulista Association, which is so kindly hosting us. And he is going to introduce our first speaker, and I will introduce our second. Dr. Dominique Splumel, who was supposed to be with us today, had a family emergency and couldn't join us, so we just have two speakers. We'll have a little extra time for questions and can also get a little bit ahead of schedule potentially. Antonio.
Okay. Well, good morning. Thank you for your presence. I some little words to. I, as president of this medical house, would like to say that the São Paulo Medical Association is very proud to receive the WMA and participate of this amazing and important meeting. The World Medical Association Declaration of Taipei is one of the most relevant ethical frameworks for medicine in the era of big data, biobanks, and digital health. Healthcare system today generates enormous volumes of information, clinical records, genetic data, registries, and biological samples. These resources have extraordinary scientific value. They allow us to better understand disease patterns, improve prevention strategies, and develop more effective and personalized treatments. However, they also raise important ethical questions. Who governs this data? How are they shared? And how do we ensure that individuals' rights are respected? I am sure that this meeting will contribute very much to do that. Adopted in 2016, the Taipei Declaration addresses exactly this challenge. It complements the Declaration of Helsinki by focusing specifically on the ethical governance of health databases and biobanks. Its central principle is that data and biological materials derived from individuals must be used responsibly, with transparency, appropriate consent, independent ethical oversight, and strong protection for privacy. Hello? Okay. These principles are particularly important for public health systems, national health systems, and universal health care. Models rely on large-scale data to guide policy, evaluate programs, and improve population health. When governed ethically, this data became a powerful public good. But this is only possible if citizens trust the institution that manage their information. In this sense, the Declaration of Taipei reminds us that ethical governance on health data is not just a technical requirement. It is the foundation of trust between society, medicine, and public health systems. By protecting individuals while enabling responsible research, the Taipei Declaration helps ensure that scientific progress truly serves the health of populations. And thank you for coming, and I am very grateful for your presence. Well, you can start the...
Do you want to introduce Carla?
Yes. Carla is the first one. Okay. I will introduce now Carla Saenz. She is responsible for the regional program of bioethics of the Pan American Health Organization, which supports countries in the Americas, primarily research ethics and public health ethics. I will resume it. It's very long. She is native from Peru and holds a PhD in philosophy from the University of Texas at Austin. Before joining the Pan American Health Organization 15 years ago, she completed a postdoctoral fellowship at the Department of Bioethics at Clinical Center of the National Institutes of Health, and was in the faculty in the philosophy department at the University of North Carolina at Chapel Hill. Please, Carla.
No, there we go. Okay, well, it's great to talk to you today, and I'm going to be sharing some insights based on my work at PAHO, which involves very close dialogue and coordination with many countries in Latin America and the Caribbean. And I just want to remind you that many countries, most countries, are not in the same position as Sao Paulo, as Brazil, and I hope to bring that perspective to the discussion. So when we talk about strengthening ethical governance of data and biospecimens in global research, we have to first figure out, what does it mean to strengthen ethical governance? What does ethical governance mean? And I think we have to keep in mind that governance entails first that we agree about some ethical content, about some ethical standards, and then we translate that agreement into effective mechanisms so we can actually implement those standards. Mechanisms without ethical standards don't work. Ethical standards that don't get translated into practice don't work either. From a global and even regional or multinational perspective, what do we need? We need to ensure that the different jurisdictions, the different countries have the same ethical standards, and that there are mechanisms that connect them to each other. And I'm not just talking about interoperability, I'm talking about mechanisms to transfer duties from one jurisdiction to the next, to ensure that whatever commitments were acquired for example, where the data was acquired, transfer to the jurisdiction or the institution where those data or samples are being used. And I want to emphasize something that we have not talked much about. So in my previous slide, I had a step 1, step 2, but perhaps step 0 that is important from a regional perspective is that we don't sufficiently emphasize the moral importance of research with samples and data and the potential that it has to advance people's health. And some of that was brought up at a previous session. And I think it's important to keep that in mind and just reflecting on the challenge that we're encountering in the region primarily with genomics research. Because if you think that there's no benefit, then any risk will bring you to a negative risk-benefit profile. So and that's why lots of research gets forbidden in many low and middle income countries in the region. So in Latin America and the Caribbean, we are having a great moment for research, I would say, since COVID. COVID made the benefits of research more tangent in a way that it hadn't been before, but there's still lack of trust. There's very limited research collaboration between the countries in our region, and the constant perception of being taken advantage of. Research is something that's done by some rich people in the north to take advantage of our unfortunate situation. And that coexists with a lot of improvement and with groups that are doing research that has great potential. I'm primarily talking about data and biobanking research that is perhaps more the type of research that gets initiated in the region than compared to, for example, clinical trials. So there is a lot of agreement about ethical standards in the region now. I've been in this position for 15 years. The type of agreement about ethical standards that we see now is unprecedented in Latin America and the Caribbean. And that agreement about what's ethically right with respect to research is captured by many legal agreements. And specifically, I didn't mean legal agreement, legal instruments. The law of the land in most countries in Latin America and the Caribbean now is formally adopt whatever is in SIOM's guidelines. That's the law. And, well, SIOM's guidelines, 11 and 12, do address research with biospecimens, research with health data, and we've encountered some confusions about, for example, what is data sharing, and that we've tried to clarify in our publication, Catalyzing Ethical Research in Emergencies. Primarily, the confusions are not about just the sources of data that has value for research, but also about what data sharing actually means, because as it turns out, people thought that data sharing involves just sharing the results of research. And so, well, this is, in this chapter, we don't mean to add anything conceptually different, just to clarify existing standards. But despite this great progress, the agreement about ethical standards does not suffice because, well, first is the question, who agrees? And we have a smallish research ethics community and greater awareness beyond that research ethics community, beyond the health authorities that oversee research ethics, beyond the committees themselves, beyond the people who teach research ethics is needed. primarily taking into consideration this topic, because the potential sources of data and samples that are valuable for research is wider, significantly wider, and we're increasingly more aware of our greater capacity to use them. So the other problem that we have is that sometimes the general ethical standards are understood, but the implications are not clear. And I'm going to give you an example that's probably one of my biggest headaches with respect to this topic, is, and it's a problem that we see throughout the region. So I'm also responsible for the Research Ethics Committee that oversees all the studies in the region that PAHO is involved with. And so we review protocols that have already been approved by a Research Ethics Committee somewhere in the region. And what we see is that there's not a clear understanding of when consent is asked. So I am doing research. I'm going to ask the health authority to give me, I want to do, say, research with the registry of TB multi-resistant patients, and I ask the Minister of Health for the list. I get the list without the consent. And when I say, like, whoa, where's the consent? And they say, oh, yeah, now I got it. Now I'm going to ask for consent. So that's a standard problem that we see. So how do we move forward? So, well, we need an effective implementation of these standards, but it's been clear throughout since we started this discussion. And actually, I have to say that a previous presentation by Dr. Amaro, I felt like my brain was put a little bit in a blender. So there are new issues, there are these new realities. And I mean, the obvious problem is the increased risk of re-identification comes with AI, but I don't need to list all these new challenges, because we need to develop ethical standards for these new realities that we had not anticipated before, or for the way in which these new realities alter the ethical standards that we have been having for a while. So regarding the mechanisms to implement the ethical standards, well, that's when we have the biggest problems in Latin America and the Caribbean. And very often we're not taking action. We know what needs to be done, but there's some sort of paralysis in terms of doing what needs done, and accountability must be enhanced. But I think that perhaps the biggest problem that we have is with regards to MTAs and DTAs. And I'm surprised we've talked so much about consent and so little about MTAs and DTAs, because the MTAs and DTAs are the mechanism to ensure that whatever promises were made to research participants travel with the samples and with the data when they go to other institutions. And I say other institutions, that's not necessarily other countries. There can be disparities between countries that are similar, within a country that are similar or greater, the disparities between low-income countries and high-income countries. So if we don't have ways to implement MTAs and DTAs, so they're not just some document that gets signed without anyone thinking about it, or as I was told in my country, Peru, so said, like, yeah, it's like this paper that Americans ask you to sign. So that was the definition of MTAs that I received. I'm like, wait, hold on a second. How do you think that the promises you made to research participants are going to be upheld? So then the point of MTAs and DTAs is to create this traceable path to transfer responsibilities to ensure that those responsibilities don't disappear. And I think part of the issues that we have is also that as we move forward with mechanisms to implement these ethical standards, we have to realize that lots of things are not the purview of a Research Ethics Committee, and this is an example of one. So, and when you look at low and middle income countries, when they're trying to do more biobanking research, do more health data research, and do it ethically, the paralysis, like, oh my God, what is a tech transfer office? Never heard about that. So that's when we start having the problem. So we, as we say, the ethical standards end up being kind of like letra muerta, like dead letters. So looking specifically at the Declaration of Taipei, there is one key ethics governance issue that is problematic for Latin America and the Caribbean, and I think this is an issue that results from translation and language issues, not an issue that was planned to be like that, and I want to say that this issue persists in the Declaration of Helsinki. So the way that it's written, I want to say the way it's mostly translated, suggests, my colleagues will say, it literally says this in Spanish, that research ethics committees are not supposed only to review protocols with human participants, including those protocols to collect samples or to collect data for research, but they also have the task to approve the establishment of the facility, of the biobank as a facility. And at the institution, the facility where the samples are going to be kept. And I had read the English version, I had not seen this problem myself, but then when you get phone call after phone call and health authorities saying that they have to change the mandate, the duties of research ethics committees, so they also approve the facilities of biobanking, you're like, okay, we're having a problem here that should be easy to address. Other issues, I mean, I cannot miss the opportunity to give some suggestions. I think that if you think about the reflection we've had in today, if you just think about today, we've talked about fairness, justice, data sharing, we've talked about important social value. However, if you look at the Declaration of Taipei, the ethical principles are strictly focused on the individuals, dignity, autonomy, privacy, and confidentiality. It seems like those ethical principles don't do justice to our discussion about justice, about bringing benefits, the benefits of science and sharing those benefits appropriately. So while they are mentioned, there's no link to the explanation of the principles that guide the content of the declaration. I think, so part of my work is helping countries in Latin America and the Caribbean with research ethics, and as part of that, we have regular monthly meetings with all the research ethics committees in one country, coordinated with a health authority. And so I do a lot of training on this, and when you get the same questions asked again and again, and being, I don't know, Guatemala or Bolivia or Paraguay or Honduras, you're like, okay, something is unclear here. And I do think that in terms of clarity, the subtitles included in SIOMS help a lot, and I think that reorganizing the content in a way that's more user-friendly would make a difference. And of course, I have to be helped, but to be fair, the Declaration of Taipei is a declaration. It's very brief. I think it's not even 1,600 words, and just those two guidelines of SIOMS have more than double the amount of words. Lastly, I think this is a great opportunity. We are in a very unique moment, and this is the revision of the Declaration of Taipei gives the declaration the opportunity to address these really novel issues that are, for example, not captured in SIOMS by now, and on which there's a great demand for ethics guidance. Again, the culprit is AI and the risk of free identification, and I really wonder, this question was raised in the previous session, whether we can reasonably, responsible, truthfully maintain the distinction between identifiable or non-identifiable data, or whether this is a moment where we need to kind of like shake. And I fear what I'm saying, but I think that a little bit of, I feel like the edifice of the building of research ethics is experiencing a little bit of an earthquake, and we have to come to terms. This is a great opportunity to address that challenge. And so I think that the AI component, the AI consequences for data research should be a very prominent part of the revised declaration. And thank you very much. That's some information about our program on bioethics. Thanks.
Thank you. Very thought-provoking. I have a whole bunch of questions, but we're going to hold them. We will have some time for questions until both of our speakers have spoken. And next up is going to be Dr. Jeff Blackmer, who many of you know as the Chief Medical Officer and the Executive Vice President for Global Health at the Canadian Medical Association. He did his residency training actually in physical medicine and rehabilitation in Saskatchewan and has a master's in medical ethics from Toronto. And many of us know him for his work, his consistent work over many years globally in the medical ethics space, among many others. And Jeff's going to be talking about the ethical oversight of cross-border use of data and biospecimens. Jeff, to you.
Thank you so much. Thank you, Jack, for that introduction. I just wanted to start by saying a sincere and very grateful thank you to our hosts here in Sao Paulo and the Brazilian Medical Association. Wonderful, warm hospitality as always. Thank you. And to the organizers of the conference, everything is run very seamlessly. The food has been great. The camaraderie has been excellent, and the talks have been first rate. So thank you to everybody involved. So I'm going to be speaking about cross-border use of data and bioethical specimens. Just going to see if I can. Oh. I think we're maybe partway through here. I'm just going to get it to the start. Yep. Now you know what I'm going to talk about. So that's it. So I think you'll hear a lot of common themes in this discussion, and in fact, I don't think there's going to be anything necessarily new or innovative in what I'm going to discuss, but what I hope to do is to sort of tie a few of these points together within the context of, very formally the cross-border use of data and biospecimens. This has been a part of a number of presentations. We heard about it yesterday afternoon towards the end of the day as well, some of the complexities and the challenges, and the fact that, in fact, this is a very common situation now, both with respect to AI and large language models, but other uses of data and biobanks as well. We're increasingly dealing with this concept, this phenomenon of these data crossing borders and the associated challenges that we have with that. So the cross-border use of health data and biospecimens is increasingly central to modern biomedical research as scientific collaboration frequently extends beyond national borders. And the movement of this data and the biological materials across jurisdictions introduces opportunities and important opportunities that we've been hearing about, but also complex ethical challenges that require careful governance. And in fact, we saw a couple of examples of that in the last excellent presentation. A major reason for these complexities is that health information, especially when linked to biospecimens, carries identifying and sensitive characteristics, and we've heard a lot about that as well. The WMA's Declaration of Taipei provides an ethical foundation for these practices and emphasizes that all uses of such data stewarded materials should uphold respect for persons, ensure responsible stewardship, and maintain the public trust. I really enjoyed that slide earlier today about what do these four pictures have in common, and it's all about trust, and we've heard that as a theme throughout as well. As global research expands, ethical oversight mechanisms have to keep pace to ensure that individual rights are protected, regardless of where the data or the biospecimens travel. And so key issues to consider during this revision process include ensuring transparency about the intended and future uses of materials, safeguarding against misuse, and guaranteeing participants that their dignity and privacy will be preserved. Ethical oversight must also address the diversity of legal requirements across countries, as differences in privacy laws, consent norms, and data sharing regulations can create uncertainty for institutions, attempting to collaborate internationally. This highlights the necessity of strong governance frameworks that can accommodate both local autonomy as well as global scientific needs, promoting cooperation while ensuring that ethical obligations to participants remain paramount. That cross-border collaboration is very, very important, and this is something that has become clear during the conversations this week. The international sharing of health data and human biospecimens is really now essential, basically, to biomedical research, public health surveillance, and innovation. Things have really changed since the last revision of this declaration. Large-scale genomics, rare disease research, pandemic preparedness, and reaction to pandemics, and artificial intelligence all depend on data and specimens that routinely cross national borders. Cross-border collaboration plays a crucial role in accelerating scientific discovery, enabling researchers to draw from diverse data sets and biospecimen collections that represent varied populations. This diversity also strengthens the generalizability and relevance of scientific findings, contributing to medical advances that benefit global populations. So this is not a theoretical construct that we're talking about in the abstract. This is a very real necessity of research in the modern context. However, as we've also seen, collaboration across borders raises complex ethical considerations because of different national laws, different social expectations, and cultural norms related to things like privacy, consent, and biological material ownership. These discrepancies make it difficult to establish universally accepted standards that exist in all the different jurisdictions where this information is going to be shared. And this can pose obstacles for research institutions trying to comply simultaneously with multiple regulatory frameworks. And this is where a global document like the Declaration of Taipei can be very effective by providing a higher level standard independent of those multiple regulatory frameworks. A key consideration here is the need to maintain the integrity and privacy of data and biospecimens throughout their life cycle, regardless of the jurisdiction where they are stored or analyzed. Ethical oversight has to make sure that international sharing does not expose participants to risk, such as discrimination, stigmatization, or breaches of confidentiality, that they did not anticipate at the time of contribution and at the time of consent. Institutions engaged in cross-border research have to commit to transparent communication with participants regarding potential global uses of their contributions, thereby enhancing trust and enabling ethically responsible international collaboration. So I want to hover on some of the core ethical principles. This does not like me. Okay, there we go. Thank you, whoever did that. So these are our ethical obligations that are common across many of the issues that we've discussed today, but I wanted to pull out a few key considerations, particularly with respect to cross-border collaboration. The ethical oversight of health data and biospecimen use is grounded primarily in four core principles: respect for persons, privacy and confidentiality, justice, and transparency. Respect for persons requires that individuals maintain control and autonomy over their data and their biological materials, including control over whether and how they are used for research purposes. Respect for persons requires that privacy and confidentiality obligations require institutions to safeguard participants' information from unauthorized disclosure or misuse, recognizing in particular the unique and particular sensitivity around health data. Justice demands equitable treatment of participants, and we've heard a bit about this already, and I think this is really a nice segue into the conversations that will take place at the next meeting in Rome, where we're going to be talking even more about equity. We need to ensure that no population is exploited or disproportionately burdened in research, and the benefits derived from research are shared fairly. And I was very interested in how Leah was sort of teasing out the differences between potential individual benefits, which are perhaps harder to ascribe or harder to ensure in this context, and thinking more about collective benefits and access to information. Finally, transparency and accountability are crucial for maintaining trust, particularly when materials cross borders and participants may be unaware of the full scope of their potential uses. By committing to these core ethical principles, institutions will strengthen public trust and ensure that cross-border research practices align with global ethical expectations. And there are some particular complexities and challenges when it comes to the issue of consent across borders. And we've already heard a bit about specific versus broad consent, some of the challenges. As you know, informed consent is the cornerstone of ethical research, but cross-border use of data and biospecimens introduces unique complexities that challenge traditional consent models. Cross-border research almost always involves future, unspecified uses of data and biospecimens, making traditional study-specific consent impractical. Broad consent, that is, allowing future unspecified research, is often proposed as one possible solution to this issue, but of course it also raises concerns about whether participants truly understand the entire range of possible future uses. Reconsenting participants for each new research project becomes increasingly impractical when materials are shared internationally, especially when samples originate from low resource settings where maintaining long-term contact with the research participants may be more challenging. These challenges highlight the importance of strong governance frameworks that can supplement consent with ethical oversight, ensuring that research uses remain aligned with participants' expectations and ethical norms. So we're back to the issue of governance, and I think that's also been a common theme throughout all of the different conversations. Ongoing transparency, clear communication, and mechanisms for participants to withdraw their materials are essential components of responsible consent practices in a global research environment. We've heard quite a bit about privacy and data protection as well. So within the context of cross-border data sharing increases the risk of privacy breaches beyond sharing data within national borders, especially as advantages in data linkage and analytics raise the possibility of re-identification. And I think Carla did a great job of saying, and other speakers have alluded to this as well, we may be beyond that threshold where we even have to talk about the possibility of re-identification and assume that, that this is the new state of the Union. Differences in national data protection regimes, such as varying standards for anonymization, data security, and individual rights, can and will create ethical gaps in cross-border data sharing. While some regions, such as the European Union, enforce stringent protection standards, others maintain less comprehensive frameworks, so that when data moves from one region to another, you may go from a very stringent to a very loose framework, or vice versa. This variation creates risks related to re-identification, improper access, and data misuse when the data moves across borders. Ethical oversight, therefore, has to ensure that institutions implement strong technical and organizational safeguards, including de-identification, encryption, secure transfer protocols, and controlled access systems. Additionally, researchers must ensure that data recipients uphold ethical and legal standards comparable to those in the jurisdiction of origin. Data transfer agreements and other regulatory tools can help formalize responsibilities, but oversight bodies must remain vigilant in monitoring compliance. And I take the cautionary note that we had before about data transfer agreements as being something that originates in America and is just complicated and something we all have to sign off on. So they have to be meaningful and they have to be enforceable. Protecting privacy is not simply a legal obligation. It is essential to maintaining public trust and ensuring individuals will feel safe contributing to international research efforts. I want to talk just briefly about governance and ethical oversight as it pertains to cross-border data sharing. So effective governance is critical for ensuring ethical cross-border use of data and biospecimens. Ethical review must occur not only in the originating country, but also within the jurisdiction that's receiving the materials, ensuring that the local norms and expectations are respected. Oversight mechanisms need to include clear policies on data access, use limitations, storage, and future sharing. The material and data transfer agreements can formalize these expectations, specifying the roles, responsibilities, and safeguards required of all parties. Ongoing monitoring is equally important, as we know, as risks may evolve over time and new uses almost certainly will arise that were not originally anticipated. Governance bodies also have to evaluate the potential harms and benefits, ensuring that vulnerable populations are not exploited and that the distribution of research benefits is equitable. Strong governance structures provide the flexibility needed to support global collaboration while protecting participants' rights and maintaining ethical integrity. We've also heard a lot about equity and benefit sharing. Equity is a central concern in cross-border data and biospecimen sharing, especially when materials originate from low resource settings or marginalized populations. Ethical oversight requires ensuring that research does not worsen historical patterns of exploitation, where benefits flow from high-income countries while source populations see little in return. And we've been challenged to think a little bit more fulsomely about this in the document and not simply raise it as a concern, but address this in a more meaningful and substantive way. Institutions have to commit to fair benefit sharing, which may include access to research findings, capacity building initiatives, technology transfer, or healthcare improvements in the community from which the data and biospecimens are obtained. Governance frameworks should explicitly address these obligations, ensuring that global research partnerships operate on principles of fairness and reciprocity. Engagement with local communities is essential for understanding their expectations and defining what constitutes meaningful benefit. By prioritizing equity, institutions can promote global justice and strengthen the legitimacy and sustainability of these cross-border research collaborations. And then I'm just going to pick up briefly and finally on this idea of trust and public engagement. So this concept of public trust is really foundational to the success of cross-border research involving health data and biospecimens. Without trust, we know that individuals will be reluctant to contribute their information or materials, undermining the scope and the value of the research itself. Ethical oversight, therefore, has to emphasize transparency and ensure that participants understand how their materials will be used internationally and what protections will exist. Public engagement efforts like community consultations, open communication channels, and dissemination of research outcomes will help maintain the social license that we need to continue doing research. Engaging communities is especially important when research involves groups with historical reasons for mistrust, and we've already heard about ongoing reasons for mistrust in this part of the world, ensuring their perspectives inform governance practices. By investing in these trust-building strategies, institutions can support sustainable, ethically responsible international research cooperation. And then I want to close by highlighting the major place in the current declaration where we mention this idea of transnational data sharing, and then give a possible recommendation for some wording that could be used to address this issue in the new environment. So in the current declaration, paragraph 12 says, if the data or biological material are collected and stored in a health database or a biobank for multiple and indefinite uses, consent is only valid if the concerned individuals have been adequately informed about, when applicable, commercial use and benefit sharing, intellectual property issues, and finally, the transfer of data or material to other institutions or third countries. So it basically says during this consent process, we should let them know that this is a possibility that this will happen, but really nothing beyond the fact that this may occur at some point in the future. And so recognizing that there is a balance between brevity of a document, but enough detail to be meaningful and cover off evolving considerations and things that have changed since the last review. Here is some suggested wording for a possible new paragraph to address some of these challenges. Any cross-border transfer of health data and/or biological materials must ensure ethical, legal, and regulatory protections equivalent to or greater than those in the jurisdiction of origin. Such transfers require valid consent or another ethically justified basis, along with transparent governance arrangements that safeguard privacy, security, participant rights, and fair benefit sharing across all jurisdictions involved. So again, I think that's something to discuss. Does this capture the full breadth of the issues that we're trying to address? Is it too long? Does it fit within the current document? Could it be folded into some other paragraphs or other areas? But it's an attempt to try and capture some of the new challenges that we're seeing with the evolution of all of these aspects of research that we've been talking about for the past 2 days, and some of the unique challenges of sharing this data across national borders. Thanks very much.
While this slide is up, I want to ask one question. Let's put the slide back up. Do you think that this is unique to cross-border transfers, or would everything in this paragraph apply if you took the words cross-border out, and everything in this paragraph applied to even transfers that happened from a health system to a corporate partner, or from a, just curious.
I think probably I'd have to give it a little more thought. But I think you're probably right. Yeah, and I think the corporate partner aspect is perhaps especially salient when we talk about regulatory protections equivalent to or greater than the originating source of the data.
So I would love to open up for questions. We have a couple to get things started up front, maybe. And Carla, as I was listening to your presentation, which was fantastic, you had the question about sort of ethics committees and sometimes whether reviewing biobanks, question the translation, particularly in the Southern Hemisphere. I want to broaden that a little bit. I was thinking about, more broadly, one of the reasons that the DOH has had influence and worked in many ways is because for research and for data collected through research, we have this pause point of an ethics committee being required as an arbiter. So to the extent that COMS makes changes or DOH makes changes, that's the teeth through which we can kind of make changes. For data not gathered through research, electronic health records, wearables, whatever, people putting things into an app, to the extent that in the DOT we come up with this fantastic list of ethical principles people should follow when storing, analyzing, sharing that data, what is the pause point? Who is the arbiter? Like, do you have thoughts about how to do that outside of an ethics committee?
Okay, so I see there, I just want to make sure I understood your question well. So when you collect data or samples for research, then you go through a research ethics committee, right? So if you want to do, but say you want to do research with some data that has been collected by others, if that data set or that is individually identifiable, you still need to go through a research ethics committee, right? That's fine. And research ethics committee can, unless it doesn't include any individual identifiers, right? So the research ethics committee ends up approving studies that use samples collected for surveillance or leftover samples for whatever. And one of the problems that we have is that you often can't anticipate that you're collecting samples for, before I get to that. So often the problem is like, oh, well, what were the terms of the consent, right? And sometimes for surveillance research, it tends to be a good candidate for a waiver of consent. But often you have issues with consent, and they tell you, well, you need to go reconsent those persons. And the problem that we have, that I think we should anticipate ourselves to and take advantage of the tools that we have now, is that if you're doing something, say one of those big surveillance exercises, for example, STEPS, right? STEPS it's a big national exercise. It's a WHO tool for surveillance of non-communicable diseases. And STEPS involves, it's a massive effort. It involves data collected for surveillance. It's not research, it's surveillance. But you don't have to be a genius to figure out like, oh my God, that data will have so much potential for research. So why don't we, I mean, you're already asking those people if they want to participate. I mean, there's a consent process for these surveillance exercise. Not that every surveillance exercise requires a consent process, but it's reasonable in this case. Why are we not including some at least broad consent for the use of
Right.
those?
So I guess my point is, though, at least for those waivers of consent, for things that are initially deemed as research, you have an ethics committee to go back to debate whether what you want to do with that waiver of consent is ethical and whether your data partners are going to govern the data in a nice way. For all of the majority of healthcare data in the world that were not gathered through research at all, that are just sitting in electronic health records, for example, you have, I guess, I'm asking sort of what do we do with the fact that we don't even have a research ethics committee to go to? So we're going to come up with a lovely set of principles, but have you thought about like what are the ideal process is? Sorry, it's a bigger question.
Well, but we do now the way it goes. It's like if you want to do, I guess there's a difference in scale, right?
Yeah.
Now, if you want to do a study in the Einstein Hospital based on like I don't know, just go look at the medical histories. You ask their research ethics committee for approval, right? That's how it normally goes. When we're talking about this, when things get out of scale and we have different ways to even gather that, I think it gets complicated, and I don't have a good solution for that.
Antonio, you have any?
But I do think that in general, in situations where we anticipate some research potential, we should start using broad consent, but it gets too fuzzy in that case.
I mean, go ahead, Jeff.
I'm not sure if this is what you're getting at, but I do wonder, so a lot of the focus in this document traditionally has been and probably will continue to be on the governance aspect versus DOH, which is more sort of the research ethics aspect. And I wonder if you know, that is something that we can point to in terms of the true value add of the Declaration of Taipei and sort of the unique focus of this, and adapting that to today's sort of particular environment, cross-border, you know, massive private industries. And also there's that conversation we've been having around sort of the role of the WMA in this area and whether we want to take that step of really sort of providing very sort of pointed recommendations, right, that may or may not be followed. So we're kind of used to, with the DOH, we're kind of used to, we know there's multiple research ethics documents, they're all very strong. We're used to some degree of deference on the DOH, right, in a way that we're not on the DOT necessarily. And I think there's some like reluctance to say we want to be aggressive and say you should be following this, but you know, you have to start somewhere in terms of setting those standards and asking other people to come along. And in fact, a couple of previous speakers did say, you know, maybe there is an appetite out there when there's no sort of universal standard for the WMA to set that, and it would take a little bit of courage and it would probably take a fair bit of advocacy and communication, but perhaps this is the opportunity to do something like that in the way that we've done it for research ethics before.
Let's go to the question in the back.
Bom dia a todos.
Good morning.
Subject, so para Carla e para o professor.
To Carla and Professor Jeff, who answered partially, I will mention a subject that is very controversial. I'm a member of the Medical Commission of World Boxing and the president of a Pan-American Boxing Association. And last Olympics, we had serious issues regarding foreigners in sport. Both, even because we didn't have a policy, anyone who declared or had their names, especially trans athletes, trans men or trans women could compete with, trans women could compete with women. There was a lot of controversy related to all of that. And of course, we have to respect all people, including the trans people. This is the first concern. Because of this, we were forced to create a policy, and we are finalizing it soon, so that we can control such situations through lab exams. And here's my first question and my first point of discussion. What are the protection layers that we can give to these people, respecting their condition, but we have to respect the women's condition, especially Professor Carla that mentioned governance, and the professor had two important slides. I paid attention to them because they will help us a lot, but I wanted to know if there is the need of creating an extra layer or a larger layer of protection so that this data is preserved. We are creating a database. I won't be in the Pan American Commission tomorrow, and they will have the access to that. I mentioned this discussion, which is very sensitive, and I'd like to hear my colleagues' opinion. If we can fit within the governance, or if we should create an extra protection or some kind of protection to protect all parties, women, men, transgender, intersex even, which are an extra subject, and they are starting to be part of sports, and sometimes they are subjected to very embarrassing situations. This is a situation very difficult due to different types of pressure, and I would like to hear your opinion, because I think the Declaration of Taipei has not considered that. So I think it's a discussion that should be brought to light for the future, especially with the sports medical authorities. Thank you for being so long.
Go back to you. So this is not a database that you're creating for research purposes, right?
É banco de dados.
It's a data bank to check the policy. We have to get all the data, the lab data, and then put them in a place. We have to store them. And the question is, what are the layers of protection for that?
One thing I would say is this is the perfect example to illustrate that there are thousands upon thousands upon thousands of places that health data are gathered. And so the DOT is probably never going to be able to speak individually to the situations, whether they're gathered for sport or clinical care or any of the employment, drug testing for working for a government. I mean, you could just imagine all of the different ways that so this is just yet another example. And so part of this really speaks to what are the expectations of the person who is sharing their personal health data. You could imagine this would be very different if you're entering into a secondary school athletic team, and the protections for somebody, a large number of kids who have to do that, if we're gathering lab data on them, would probably be much higher than at like the Olympic sporting level, where in return for getting to participate, you agree to share data so that they can make sure you're not doping, et cetera. So a lot of this has to do with consent in advance about what's going to be done with the data, and then expecting those bodies, I guess, to respect that. But I think when you're about to join the Olympics that if you're caught doping, you probably consent at the time that you give the data that that's going to end up being public when you get kicked out of the Olympics, which might be very different than, I don't know if we're getting at your question, but I do think that your question introduces this large topic of the reality of how many places we gather data, and that if people don't consent and those data are then shared with other databases, then it starts to introduce all the questions our speakers have raised.
I think that's a great answer. I have very little to add except to say that this is in many ways a non-clinical context that is gathering potentially very sensitive clinical data, and you could compare and contrast that to gender-affirming care, where someone goes voluntarily to a clinic and says, I identify as a different gender than I was assigned at birth, and the levels of protection and the requirements for consent might be different there as well, even though some of the underlying principles and considerations are the same. So I agree with Jack. I think it just points to the complexities of the situation and the need for clarity in the document.
And so I think, Jeff, you're raising sort of issues around people experiencing vulnerability as well, and the fact that their level of risk might be very different if you're a trans athlete, intersex, et cetera, given stigma issues in society. All right, other,
To some extent, this issue goes back to your previous question because it's a major issue is that the lines between research, use for research and not used for research are getting blurred and blurry. That our capacity to just extract and use for research has been magnified, and I feel like it's like we created a system where we're used to, I don't know, taking buckets of water, and now the dam broke, and you know, we have the entire ocean coming on top of us, and that's what's making us question to what extent some of our tools are even appropriate. And I think that other than coming up with versions of them, I'm afraid I don't have any other solution.
Antonio.
Eu queria dar uma opinião.
I like to give my opinion. I think that this data collection that is done has to be based on previous research. We have to create, regarding research, group of transgenders, compare them as male, female, and then from there have data research that are affected and based on evidence that we can use to say if that transgender can compete with women or men. That's not at the competition moment. This is a research that needs to be done previously to the competition.
Jeff, while we wait, you had talked about in your proposed paragraph at the end, which I don't have in front of me, but sort of requirements for, in particular, cross-border sharing. There's been a lot of mentions at this meeting about the realities of re-identification. So should those types of data agreements basically require that any external partners not attempt, since we know they all can, not attempt to re-identify? Should we be very explicit about that up front, that somebody needs to?
I think that's certainly one approach, and I think that would be quite reasonable. The flip side of that is there's lots of questions around enforcement and mechanisms. That is certainly one where you would be asking a lot in terms of voluntary sort of participation by folks who may or may not have an interest in that re-identification, right?
Yes.
I think you wouldn't want to necessarily count on that as being set in stone, even if we recommended it. I think you would still.
But it's a step forward from where we are now, where
sure.
there's not even an ask not
Absolutely.
to try.
Yeah, absolutely.
I have a doubt in Portuguese, please.
I am the president of Brazilian Society of Urology in Brazil. And one of the issues that I would like to mention, we have in the table Professor Antonio, a colleague, that there's robotic surgeries. A lot has been said over the last couple of days about biobanks and data banks. I would like to about image, because robotics in the world today has a number of companies now, Chinese, a number that receive always the images of surgeries through a channel online. The patient doesn't sign any consent saying that the surgery goes to Intuitive, the company that holds these images. That's the first point. Should there be a specific consent for this? Second question. Nowadays, we have telesurgeries, intercontinental telesurgeries. How should a surgeon operating in another country receiving these images deal legally with this? Our Federal Council of Medicine authorized telesurgery. But how do you all think about the transmission of these images to even another country, the intersection of these images? Thank you, congratulations. This is my final participation here. I feel very impacted, touched This is a disruptive discussion and transformative discussion for all of us.
Na minha
Hospital, we recently discovered the number of devices in any given operating room that are transmitting data back to their manufacturers is stunning. And as we account for all the data we're collecting, nobody had really taken account of this. It's a great point. I mean, as are probably numerous things in this room and our televisions at home and everything else, but these are patients. This is healthcare data.
Yeah, and I think that with regard to images, we've always assumed that you can make the person non-identifiable by, just removing the face, and that is absolutely not true now. So I think this is yet another issue that perhaps needs to be that contributes to our to questioning our distinction between identifiable and non-identifiable data.
Been some interesting studies lately that the AI tools developed on radiologic images, some of what their predictive value is actually on non-de-identified images where they're looking at the name and other characteristics of the patient demographics and building it. The AI tool has sort of accidentally built that into the model.
It is a really interesting question, and it raises the issue, of course, that every time we sort of figure something out in this declaration, something new comes up, and it, when you revise it every 10 years, it's already outdated as soon as it's printed. But that's the challenge in these types of things. I would just say that when you know that the data is, images are really just a type of data, digitized data. When you know for sure they're going to be transmitted, I think consent is required. To Jack's point, if you don't know, there's things in the OR that...
But Jeff, what does this look like? So if you're going to go have your robotic urologic surgery, and there's 6 devices in the OR, all of which are gathering and transmitting data, plus whatever's going into your electronic health record, plus 3 AI decision support tools that your surgeon is using to help plan the surgery, plus the administrative and billing AI tools that the hospital... I mean, we're talking about a consent form that lists the 37 data gathering elements that you're going to be exposed to during your hospital stay. Is that meaningful consent?
Yeah, so I guess my point is that there will be some that are very specific and identifiable, and for example, to that point, you're operating in this jurisdiction, images are being transmitted to this jurisdiction. I think the person should know that, right? That would be sort of like...
Is there an option to turn it off? Or do you just
there would be an option to say, I don't think many people would opt out of the surgery, but I think they should know that it's a meaningful, identifiable potential risk of loss of that data.
Thank you all for such an interesting conversation. I think that we have not underscored enough, we've sort of ignored the role of education and notification, and sort of moved everything into consent when some of these issues are notifications. You can't do that surgery without 37 different apps or data transfers. But the public doesn't know that, and they don't know that we're using the data in very good ways that will eventually really help everyone. Mammography is better because of AI than anybody looking at a mammogram. X-rays are the same now, and that's all trained on, huge amounts of data, and yet people don't appreciate it. So I think a lot of this has to do with both education, general education, and then, to your point, notification that this is, if you think that's essential. And I would say that that's only essential if there is risk in that execution of that data transfer.
And how much of that notification is reasonable or possible at the individual level, checking into the hospital for your surgery, versus have we failed to have open discussions with our communities at large about what we're doing with their healthcare data?
Well, that's why I distinguish education to the public and our role in that, and the notification if you think that's important, which could be in the hospital consent. But individually, I don't think it's practical.
I just want to say something in regards to what Barbara said. I think that throughout this discussion, we've many times presented this dichotomic view between the individual and society, and we have not highlighted the ways in which the social benefits are benefits for the individual. And so that, I think, is key to this discussion. And of course, what Dr. Tatiana Almeida said yesterday, but well, it's not that we're starting some of this conversation from nowhere. There is already some experience consenting to data, use of data, collection of data from apps, for example. I mean, yes, we were talking 37 devices in a hospital, in an operating room, but how much data is being collected from my iPhone this morning? And I think that in terms of when we think about educating the public, perhaps we should say we should start educating ourselves about how the public is handling this issue and try to think about a new model. And I think that may help.
Yeah, and I just wanted to agree and go back to, Jack, your question to Jeff about if you take out the cross-border transfer of that really terrific paragraph that you've drafted, because as a medical device company, all that data coming back to our company is being used to improve the actual products and understand and learn how surgeons are using it and make it better and safer. And so there's that element of fair benefit sharing that you get in Jeff's paragraph to say if you're doing these transfers and the intent and the purpose, and to Barbara's point, if you're notifying and educating, I think that's a really great system to start building the trust in there and not hamstringing it by putting 37 things that they have to consent to. And the other comment I wanted to make is I think that we have an opportunity to learn a bit from what we did with clinical trial data sharing 10 to 15 years ago. A lot of the things we have people commit to not try to re-identify, to publish their results, to use it for the purpose. So I think there's some interesting principles we could pull forward from that as well that apply broadly in this. But I really loved your paragraph, Jeff. I think that goes a long way to helping some of these issues.
And that broad education is clearly going to have to be done in a thoughtful, balanced way, right? I mean, if we approach this from just saying that all these tools are really helping and your radiology, your mammogram's better because of these tools, but leave out the part that, oh, by the way, we've had a side effect that we've de-skilled the radiologist who's supervising the tool, and oh, by the way, this tool has caused a bunch of health inequities, but we're working to make them better. Like, we're going to get called on the carpet, so that is going to have to be a very balanced conversation. Any closing thoughts from any of our speakers before we turn things back over? Well, thank you all for engaging the discussion. Please join me in thanking our fantastic speakers, my co-moderator, Antonio, and we have one session to go.